Assalamu alaikum. Now the history, CNS history epilepsy. The scenario may be just yesterday. Um, Arif was admitted due to status epilepticus. Take focus history from mom. So just like other history introduction. Hello, good morning. This is Dr. Roxana, one of child doctor here. Am I speaking to Arif's mom? So how can I address you? Thank you for coming. So today I'm here to take the detailed history of Arif's health condition. I know that it's a very difficult time for you as Arif was admitted yesterday due to a long period of epilepsy. Yes. So during this discussion, I will take some important note. Is it okay? Okay, so will you please tell me more about the event? So in the event history, first we want to take this event history in the manner that first the before the event, what happened, how Arif was doing. Do you have any mobile recording in the mobile phone? Any behavioral abnormality do you notice before the event? And can you please describe me during the event what was he doing? And in this history, we are in this portion we are looking for is was the epilepsy generalized or focal? And does he pass his did he pass his P and Q at the same time? How long it was the period was, and how was the event terminated, and after the event what happened, how much time he was unconscious, and how the event was terminated. Is it the first episode, how frequently it occurs, and what do you did for it when he was diagnosed a case of epilepsy, and what medication is going on, and is he regularly taking this medication? When did you last follow up with your doctor, and what investigation was did so far for this epilepsy? And now, um, what you think about the cause behind the last attack? And then take the constitutional symptom. Do you have any concern regarding Arif's weight? Does he has any kind of fever? What about his activity? And then Mrs. Aisha, now I'm going to ask you few questions about different parts of his body to make sure that all are normal or not. Does he have any behavioral abnormality, any weakness in any part of the body, any visual disturbance? Do you have any concern regarding hearing and vision? What's about his pee? What about his poo? uh, does he lost any of his skill, and does he has any long standing medical illness other than this, and uh, except you who give the medication, does he was under any kind of surgery, any kind of trauma, especially on the on head, any traveling recent traveling history? Do you have any emergency access plan? And then pregnancy, did you have any problem during your pregnancy? Do you have any concern regarding his development? Does he has any allergy to any medication or any food? Can you describe your family for me? And did he receive all of his jabs, and does your family this kind of fees is there, or any neurological problem? And then social history, what do you do for your living, is it satisfactory? And what is the does your home any home modification done or not? What about his schooling? Do you feel any kind of bullying? Does the school nurse know about his condition? And what is the impact of Arif's condition in your life, on Arif's life? What is your biggest worry? And is there anything else that we haven't covered that I should be aware of it? and then thank you. So today I took the history from Mrs. Aisha, mom of Arif. Arif has been suffering from status epilepticus, for which he was admitted yesterday in the emergency department, followed by PICU admission. And after, this was generalized tonic-clonic type. He was a diagnosed case of epilepsy for last 2 years, and there is poor compliance with carbamazepine, and recently he has upper respiratory infection, fever, and mom, their financial condition is unstable. There is no family history of such kind of illness. Development is normal. So what examination I will go through examination, airway, breathing, circulation, vitals, and neurological examination. These are any neurocutinous stigmata present or not, and formal developmental study, assessment and investigation, 12 lead EEG, um, 12 lead ECG, and sleep EEG, and sleep deprived EEG, drug level, is there any overdose or non-compliance, and serum calcium, blood glucose, liver function test, and management, acute management and long-term management. In case of acute management, in 0 minute airway, breathing, circulation, oxygen inhalation, and blood glucose, 5 minutes buccal midazolam or IV lorazepam, 15 minutes second dose of IV lorazepam, and 25 minutes phenytoin or phenobarbital, and 45 minutes rapid induction sequence by thiopental sodium. And we will keep the patient in follow-up, and long-term management by multidisciplinary team, pediatrician, pediatric neurologist, and liaise with school social worker, support group, and local epilepsy nurse specialist, and lifestyle modification, and supervised and advice for the late teenager, career plan, counseling regarding contraception, sleep hygiene, and then the continuation of the anti-epileptic medication. So anti-epileptic medication, there is carbamazepine, lamotrigine, phenytoin, sodium valproate. So the precautions from sodium valproate is N for nausea, V for vomiting, and A for alopecia, P for polycystic kidney disease, and register R for resistance to insulin, T for teratogen, E for enzyme inducer. Phenytoin, P445 enzyme inducer, and H for hirsutism, E for enlarged gum, Y for yellow discoloration, T for teratogenicity, osteopenia, inhibition of folic acid, neuropathy. Lamotrigine side effect we can remember by Rado watch, such as R for rash, Steven Johnson syndrome, A for ataxia, D for this blood dyscariasis, and O for just for mnemonic we have to keep this O. And carbamazepine, blood dyscrasia, diplopia, ataxia, Steven Johnson syndrome. Thank you.